If you're waking up with low back pain every morning, it could be that your back is stiffening up overnight, that you need to rotate or use a new mattress, or maybe you need to be evaluated by us to see what's going on and get down to the root cause. I'm Steve McGrath. I'm an interventional pain physician. I specialize in anesthesiology and interventional pain injections. Low back pain is a very common medical problem. Common sources of low back pain are facet arthropathy, disc degeneration, herniated discs, or sacroiliac joint dysfunction. If you have facet joint issues or disc degeneration, you would tend to have mostly localized low back pain, particularly with facet arthritis or facet issue. If you arch your back, twist your back from side to side, that typically would elicit some pain. A disc issue, however, you could be bending forward, moving in different directions, which could also elicit the pain. If you had a herniated disc that was pushing on a nerve, you would feel that pain potentially going all the way down the leg to your foot. When that disc contacts the spinal nerve, that's what elicits that sensation or that pain all the way down the leg to the foot. We call that radicular pain. Radiculopathy is typically pain due to an irritated nerve in the back. Neuropathy is typically more thought of as pain affecting peripheral nerves and can present in different ways, depending on what type of neuropathy that is. For example, diabetic neuropathy, people will get burning, tingling in their hands or feet, and it kind of starts to rise up their feet or their legs over time. Radiculopathy tends to start in the back and goes towards the legs, and it goes in a specific area called a dermatome. When that nerve is pinched in that specific level of the back, it creates a somewhat predictable area where the pain will radiate down the legs, whether that's down the back, down the side, down the front of the leg. The SI joint is not someplace everyone's always looking for. So your SI joint is a little bit lower down and off to the side. The SI joint means sacrum and iliac, so it's where those two converge together. It's typically about an inch or two to either side. You can get pain in the back and down the back of the leg. Typically that pain doesn't go past the knee if you have sacroiliac joint pain, or what we sometimes refer to as sacroiliitis. This bone here is considered your sacrum. This one is considered your iliac crest, which is part of the pelvis. They converge here, which is called the sacroiliac joint. People typically have pain just off-centered. It starts here, it radiates down the back of the leg. We can push on that joint to elicit pain. There's several tests we can do called like a Patrick's test, a compression test, or a Faber's test, where we rotate the leg in a specific manner or the hips, and it generates pain in that area. Physical therapy can help with SI joint pain, and if it doesn't respond to physical therapy, sometimes we can try injections of cortisone right into the joint. When you're managing back pain, if you have a back pain flare like this, the most important thing is to rest, use a heating pad, take some anti-inflammatories, and give it a week or two. After a muscle strain, it's not uncommon to have pain for a week or longer, and then things can improve. If your pain persists, it's definitely a good time to come in and be evaluated. If you have any major neurological changes, such as weakness of the legs, bowel or bladder issues, you should be urgently evaluated by a healthcare provider.